Okay, I think we're 1 minute past the hour, so I think we can kick off. We've got people coming in as I speak, so that's great. Good afternoon and a warm welcome to you all. My name's Nicola Bedlington and I have the pleasure and honour of moderating today's webinar on the role of the Recovery and Resilience Facility in enhancing equitable access to healthcare, examining a new paradigm. The event is organised in the framework of the European Parliament Interest Group on Equitable Access and the Patient Access Partnership, better known as PACT. And during the course of the meeting, we'll hear from two co-chairs of the MEP Interest Group. Our keynote address will be given by the European Commission, and a subsequent panel will explore different perspectives on the Recovery and Resilience Facility, bringing in key topics such as the European semester and the country-specific recommendations. Please, during the course of the meeting, add your questions and comments to the chat and we'll do our best to address them during the panel debate. And the meeting is being recorded so you can watch it back later on and also perhaps share it with other colleagues who haven't been able to make it today. So without further ado, it gives me great pleasure to invite Andrei Kovachev, MEP Andrei Kovachev, a co-chair and founder of the Interest Group on Equitable Access to Healthcare, to say a few words of welcome and an introduction. Andrei, very good to see you. The floor is yours.
Thank you very much, Nicola. It's very good to see you and very good to hear and to see all of you. Welcome to our panelists, to my colleagues, and to all stakeholders to which we provide in the last year's platform in the European Parliament. Unfortunately, now virtually. Hopefully, we can go again back to some kind of normality and we can meet each other in the building of the European Parliament very soon. This to happen is also could be the result of the success of the resilience facility and recovery facility, which is one of the maybe biggest initiative of the European Union in the last decades. How to find a way out of the current situation and how after the approval of 22 now recovery and resilience programs of the member states, this can be translated in the effective steps of overcoming the problems, the infrastructural problems in the access to health. There are still, this is still ongoing, a lot of discussions, sometimes very emotional discussions in the member states on the recovery and resilience facilities, which part is important, what provoke more or less a lot of emotions. In my own country, in Bulgaria, we are still under evaluation by the European Commission of our recovery and resilience plan, and hopefully till January or February, all of the plans can be approved. I know that Netherlands still didn't provide their plan, and I hope they are going to do it very soon. A very important aspect of the plans is that the investment and the projects that will be implemented have to be for future-proof, and in this regards, the plans aims to help the EU achieve its green and climate goals with creating jobs and spurring growth in the member states. Member states allocated almost 40% of the spendings in their plans to climate measures and more than 26 of the digital transition across the 22 recovery and resilience plans approved so far, as I mentioned before. There are different level of technological advancements between the different regions of the EU, and especially in the health system, there's still a lot of unequal access. This is why I'm very much looking forward to today's discussion and the input from our experts on the expected reforms of national levels, the implementation of monitoring of the plans, and improved digital skills for the local health authorities. There are a lot of important topics. Yesterday, our EPP group had a meeting with the chairman of the European Medical Agency on the not only on the COVID vaccines, but also on the COVID therapeutics, effective new therapeutics which can help for the faster recovery and faster starting again the some kind of normalization of our life. There's a lot of uncertainty, and also as a member of the special committee for disinformation in the European Parliament, I can tell you, and you know very well, that the health sector is also object of a lot of disinformation. The public is unsecure, have uncertainty what is wrong and what is right, and quite a big share of our population is victim of some disinformation campaign. We had a very ugly incident 2 days ago when one of my colleagues was attacked with Molotov cocktails because of his opinion on the vaccines, which other part of society is against this, and this is something really unique, that the health crisis or the health problem creates so much emotions and even division in our society. There's a lot of aspects, and again, Nicola and all friends from the PACT and all panelists, thank you very much for being again together with us here virtually, and hopefully soon also on site in the European Parliament. All the best from my side, and thank you again, Nicola.
Thank you, Andre, also for outlining the uncertainty and the emotions linked to the period that we're currently living in, and the importance of the facility in future-proofing and leading to a better society across the entire European Union. Moving now to our second co-chair of the interest group who's present today, MEP Tomislav Sokol. A warm welcome to you, Tomislav, and thank you very much for joining us today. I know that you would like also to say a few words of welcome and set the scene as well. Please, the floor is yours.
Thank you very much. I think this is a very good event that is being organized today. I'm especially glad that this is going on at the same day when we are actually voting for the Becker report on Europe's Beating Cancer Plan. So this is a very important day for oncological patients and everybody related to healthcare provision related to cancer in the EU. And I'm glad that we can discuss this important topic. So of course, what I would like to say in the beginning, which is often mentioned, but also used as an excuse, and that's the fact that European Union competences in the area and powers in the area of healthcare are pretty limited. We know that organization and funding of national healthcare systems is my member state competence, but I believe that despite of this fact, EU can still have a big role to play. And I think that EU can provide the added value and resolve those problems which member states cannot resolve by themselves. And one of the biggest problems that we are facing today is inequitability of access. So if somebody could turn off their microphone, please. So inequitability of access. So we know that possibilities to finance healthcare systems is very different in different member states. So not financial capabilities of Romania and the Netherlands, for instance, are definitely not the same. And this also relates to concrete health outcomes. And in the area of cancer, we have concrete data that there are 40% bigger chances of dying from cancer if you contract cancer in one of the countries of the Eastern Europe than if you contract cancer in one of the countries of the Western Europe. So these differences in the standard of healthcare provision is something which is definitely a very big problem. This is something that is definitely un-European, and we cannot speak about the real European Union, about European Union citizens having equal rights and equal possibilities if this kind of difference in terms of provision of and access to quality healthcare exists. So what you can do about it? Actually, even though we cannot harmonize national healthcare systems, we don't have this regulatory possibility, we have a lot of instruments, financial instruments at our disposal to reduce these inequalities. And I will list here three main sources of funding. So first is the EU for Healthcare. So EU for Healthcare, the new healthcare budgetary program, which amounts to around 5.3 billion euros, which is 12 times bigger than the previous healthcare program in the previous multi-annual financial framework for the previous 7 years. So 12 times bigger. But what is even more important is that EU for Health program is actually the smallest financial instrument which EU has at its disposal to finance healthcare in the European Union. Because if you look at cohesion policy, the main aim of which is to reduce inequalities in living standards across the EU, we can see that in the previous 7-year period, around 25 billion euros were invested from cohesion policy into health infrastructure and health personnel, health workforce, which means that this has been traditionally the biggest source of funding for healthcare, for reduction of these inequalities in the European Union. And I'm personally glad that I'm in the Regi Committee on Regional Development, which deals with cohesion policy. I'm the rapporteur actually on the topic of how to use EU cohesion policy to reduce inequalities in healthcare provision which exist today. And so that is the second source of funding. And the third source of funding, which is completely new, is the Recovery and Resilience Facility, which amounts to a big opportunity, not just to fund healthcare systems, but actually to reform them. Because you know that the whole point of the Recovery and Resilience Facility is to make national systems, especially healthcare systems, more resilient to future crises. And in order to do this, we need reforms. So we need to see how to better channelize funds, how to better allocate resources, how to better set priorities, how to better organize our healthcare systems. And here in the Recovery and Resilience Facility, actually we have at our disposal also a framework on actually following what member states are doing and evaluating their progress. So here the way how money is being spent by the member states will be evaluated on the European level, depending on how much of reforms they are making, which is important because now for the first time we have actually a binding tool, a tool which is binding upon the member states to actually control and see how they are organizing their healthcare systems and how they are spending money on healthcare. So it's not just a question anymore of giving them money and them themselves deciding what to do, as was the case before with cohesion policy, but now we actually have concrete benchmarks and concrete conditions whereby we can check what member states are doing and how they are spending their money, and whether this spending is in line with what they promised to deliver to the European Union. And of course, European semester is also very important here. The healthcare within the European semester has become much more important. We have much more country-specific recommendations now on healthcare than before. In the beginning, the whole European semester was only about austerity and not about health outcomes, health objectives, etc. This has changed. So this is also one important instrument which can be used to actually see what member states are doing and actually impose certain conditions on what they have to do. So to conclude, I think that European Union's role in the area of healthcare has becoming bigger and bigger. The crisis has shown us that there are many problems which member states cannot resolve by themselves. European Union has a lot of new instruments and old instruments, that can, especially financial ones, to help member states to reduce these inequalities which exist. But what is important now is that member states will actually have to deliver, and we on the European Union will actually have the benchmarks and the framework to actually control how this money is being spent. So I think, which is very important, because I think that this synergy is crucial if we want to achieve the health outcomes that and improve healthcare provision in all parts of the EU when compared to today. So again, thank you very much for this. I hope I wasn't too long, and I look forward to the interventions from the speakers. Thank you very much.
Thank you so much, Tomislav. First of all, for actually outlining and framing this meeting in the context of the profound inequalities that exist across the EU member states and also even within member states through the prism of cancer, but also giving us a little bit of a helicopter view of the instruments that now exist that make up essentially the European Health Union. That was absolutely great. I'd now like to welcome Ms. Ingrida Pucinkaita, who is the country expert from the Resilience and Recovery Task Force within the Secretariat General of the European Commission. A warm welcome to you, Ingrida. It's great that you've made time to be with us today. Ingrida will set the scene with some background on the facility and its role in enhancing health systems resilience and access. And then once we've listened carefully to Ingrida, we'll move into a roundtable discussion. So the floor is yours, Ingrida, please.
Many thanks, Nicola, and good afternoon, everyone. As mentioned already, I'm representing the Recovery and Resilience Task Force within the Secretariat General, and we're working hand in hand very closely with DG ECFIN, but also with the colleagues in the line DGs, with DG Santé, with DG Reform and the others, so that we ensure synergies in our work as regards in particular the RRPs. So I was invited to give you a short overview on the Recovery Resilience Facility in enhancing equitable access to healthcare, and I'm glad to do so. Next slide, please. So let me give you a short overview, the state of play of where we are today. Next slide. Just to start, overall, as already mentioned, RRF, Recovery Resilience Facility, presents, in fact, a unique opportunity for Europe, and this is to make it more resilient from a social, economic, and institutional perspective, and to support sustainable and inclusive growth. What we expect that the RRPs, RRF, will raise growth potential. The measures included reforms and investments, and on top of the national investments, and this will be backed up. And it is also important to stress that the reforms and investments based on so-called country-specific recommendations that had been addressed to each and every member state in the last European semesters 2019 and 2020. So overall, what we have in terms of the volume, the Recovery Resilience Facility will provide a huge, substantial amount, up to 724 billion, and this is to support investments and reforms undertaken by the member states. So if we look at the grants and loans, you might be familiar already with the concepts, that breaks down into 338 billion in grants and around 386 billion in loans. Also, just to outline, briefly mention, Recovery Resilience Facility entered into force in February this year, and it is operational until the end of 2026. For the moment, to date, the Commission has received the national plans from the 26 member states, and it has come to a positive assessment for 22 plans, so you have those listed here. In terms of the 4 member states, Hungary, Poland, Sweden, and Bulgaria, already mentioned, the Commission continues its assessment, and also RRP, Recovery Resilience Plan for the Netherlands, is awaited to be submitted, to be formally submitted. Also to mention before we move on and zoom into the health measures in the RRPs, this is to say that we have been closely working with the member states, that the plans they have submitted, they will submit, the remaining member state will live up to the requirements and objectives of the Recovery Resilience Facility regulation. Next slide, please. So now let's have a look of where we stand in terms of the health measures in RRPs. And so first of all, I would like to mention that health system resilience, health as such, is among the 6 main pillars of the RRF, Recovery Resilience Facilities. You have those here. We talk about the green transition, digital transformation. We talk about the smart, sustainable, inclusive growth, social and territorial cohesion, and importantly, and as highlighted here, health in the pillar, and last but not least, the policies for the next generation. Also, it is important to highlight that the measures included in RRP are to address the country-specific recommendations or a significant subset of them. So I've mentioned that already, but I think that's indeed a very important point to be highlighted again. In terms of the digital expenditure target that was already mentioned previously, so the plans positively approved meet the so-called 20% of digital expenditure target, and there we have a link to e-health that I will elaborate later. Just a few words on the CSRs, country-specific recommendations for the member states. You might know that in 2019, 16 member states received the CSRs addressing health system, and in 2020, for the very first time, all 27 member states received a country-specific recommendations on health, and that this was focusing on resilience in particular. So that emphasizes the importance for health. When we talk about the member states and them having worked on their resilience plans, when they were preparing their resilience plans, we see that overall the member states have shown a strong commitment in improving health systems by including the measures dedicated to health in their plans. We found health-related measures in all recovery resilience plans that will contribute to strengthening social cohesion and resilience. Next slide, please. Now let's talk numbers, and let's see how that how that boils down and then fits into the overall context when we talk about how much has been allocated to health. So here you have an overview of the breakdown of social expenditure. For the 22 adopted plans, we have around 445 billion euros for those plans. So the social expenditure accounts to approximately 127 billion, and which makes up to 30% of the total envelope. So why social expenditure? Well, here you have the elements that contribute to the overall pie chart of the social expenditure. And here we talk about the social protection, adult learning, skills, employment, labor market institutions, early childhood education, and of course LTC, and importantly the healthcare. For the healthcare, we have, and I will elaborate later. So for the healthcare, for the 22 adopted plans, we have around 37 billion. Here I have to make a disclaimer that the numbers are preliminary and they're being refined so that we establish a final figure for the 22 member states. Next slide, please. Now let's see the health and recovery resilience plans in terms of so the where we are today. So as mentioned, all endorsed plans have the measures. We have 22 plans, 37 billions. Also, it might be important for you to know that the 37 billion euros for the 22 plans, they correspond to nearly 8% of the plan's total expenditure. Now, health is also intrinsically linked with the long-term care. If we consider also long-term care for the 22 member states, the amount would account to around 41 billion. And also just to briefly mention that for 26 member states for the health expenditure, and of course here I have to mention that if and when the remaining recovery resilience plans will be adopted, this might account to around 43 billion euros. Now, if together health and long-term care for all those plans, the estimates show that it might account to around 50 billion euros. Again, just to highlight that the estimates are preliminary and subject to changes as well, still checking them. Next slide, please. So one thing is to talk about the numbers. More importantly is to see what we have in the recovery resilience plans when we talk about health. So overall, as we see, member states, including the health measures, they've shown a clear commitment to strengthen the functioning of the healthcare systems. And they included a wide array of health investments and reforms. And those measures, investments, reforms, we can look at, them contributing to a variety of objectives. If we talk about strengthening resilience of the system, here we have the blocks of measures, the elements pointing to reorganization of the hospital networks. Here we also talk about adjusting infrastructure settings. Also important element, digital transition in healthcare. So it's strengthening the transition, but also importantly, strengthening the healthcare workforce. Important element when we talk about accessibility to health services. Now, another objective those measures contribute to is improving the access and cost efficiency of healthcare. And here, just to mention, here we talk about the improvement of primary healthcare, also the transition from hospital care to outpatient care, modernization of the healthcare facilities, upscaling of healthcare prevention, also increase in the quality of treating patients, of diagnosing, and rebalancing distribution of services at the regional level. Already mentioned, healthcare measures, a few of them included in the recovery resilience plans are intrinsically linked with the long-term care. And in this context, also to highlight that this so-called deinstitutionalization strategy for the long-term care community and home-based care is followed and considered. Let's move on. Now, if we look closer of what those measures are and what we have for all those member states that submitted the plans adopted. So in terms of specific reforms and investments, let's look on the one hand at the investments and the reforms. Again, we see a broad variety of those measures included in the plans. So when we look at the health investments, we see that they are being put into construction of a new or upgrade of existing health infrastructures. So here we talk about hospitals, centers for prevention. Also, a few plans refer to mental health facilities, laboratories. These are complemented by measures in modern medical equipment. And here to mention the medical devices for diagnosis and treatment of cancer patients, strengthening also over resilience of the cancer prevention and care system as such. Also, when we talk about investments, we have in the plans investments in primary care, prevention already mentioned, and also workforce. And these measures, these investments, they aim at increasing the location for primary care, and especially in rural areas, opening the new primary care clinics, outpatient clinics in deprived areas, also introducing mobile pharmacies, offering primary care services. Here, important to point the strengthening of role of general practitioners come into question. and also investments in modern medical equipment. So e-health investments, creating new platforms, digital tools, etc. So looking at investments is one, but investment support reforms. When we look at the reforms, we see that member states in their plans they included an ambitious reform agenda. Of course, importantly to stress, what will matter in the end is the effective implementation of those. But when we look what we have in the plans today, we see that the agenda features reforms to strengthen the resilience of the health sector and increase the availability of integrated and high-quality healthcare. So in a few member states, we see that there is a limited availability of healthcare workers outside the major cities, and that contributes to inequality and also to impeded access to primary care. And for those member states, we see that the key reforms focus on reorganizing the health systems so that to strengthen their capacity and also establish the mechanisms to attract and retain health professionals in specific regions. We also see that some plans include reforms of the management of the public health funds and health investment funds, as well as reforms of healthcare governance and human resources in the health sector. Also in the plans, there is a very clear focus on digital health. Around half of the member states clearly put in their plans the digital e-health measures. So several recovery and resilience plans contain those. And as already mentioned, they contribute to allocating at least 20% of the facilities budget to digital transition. Here, when we talk about the e-health digital transition, member states dedicate the resources to health information assets, digital upskilling, transformation of healthcare delivery via telemedicine, etc. Also, just to briefly mention that there are also measures in the plans in providing incentives for R&D investments, for instance, to pharmaceutical companies. Next slide, please. So let's see what the next steps are and what is in front of us awaiting in terms of implementing the plans. So as mentioned, we have 22 plans already adopted. 4 plans are under assessment by the Commission. 1 is still to be submitted. Just to say also that overall what we see a promising investment and reform projects in health under the RRF, and the areas included are primary care, outpatient and digital health. And this is combined with the so-called efficiency-oriented measures to enhance the governance, cost-effective and quality of health services. In terms of the pre-financing and the first payment requests, and also the way we work with the member states in implementing the recovery resilience plan. So let me mention the following one. Concerning the pre-financing, the Commission has so far disbursed more than 54 billion to member states in pre-financing. And as regards the future payments under the recovery resilience facility, as already mentioned in the introduction, they will be made against performance. So hence the importance of effective implementation of the RRPs. We are working closely with the member states towards finalizing so-called operational arrangements to be signed with those member states. Now, what are the operational arrangements? These arrangements will fix the details of how the fulfillment of milestones and targets will be demonstrated, and also how we engage and work together in the coming 6 years with member states to monitor the implementation of the member states' plans. The signature of those operational arrangements is needed before first regular payment requests can be made. And also to mention that already 2 member states have signed the operational arrangements, Spain and France, and we also have already received the 2 first payment requests from these member states. As to the link with the European semester, so briefly mentioned here, let me just say that, well, as we know, a few measures are included in the recovery resilience plans are to address the challenge identified in the country-specific recommendations, or a significant subset of them, and effective implementation of those plans is essential in this context. The last few words about the involvement of the social partners and civil society. I cannot stress more the importance of involving the social partners and civil society. So it will be crucial for the implementing of those plans in the years ahead. And this will be also crucial in all stages of implementation. So submission of the plans, adoption of them has been only the first step for us, but also for the member states, and what counts will be the implementation phase. And maybe just to conclude that how we see the health reforms investments to be supported by the facility provide a robust fundament to reach the ultimate objective of having in place a coherent approach, and this is to ensure that the resilient health systems absorb shocks, such as the pandemic that we have been experiencing, we are experiencing, but also to strengthen the efficiency and improve access to healthcare. I'll stop here, and thank you very much for your attention.
Thank you very much, Ingrid, for that very clear overview, for sharing with us the preliminary numbers, for going through the reform agendas of many of the member states linked, to, of course, to the investment, and of course, going through very briefly some of the anticipated next steps. That was really great. I'd now like to invite all of the panelists, and only the panelists, to put their cameras on, please, so that we can kick off with our virtual roundtable. And for people who are not part of the panel, if you wouldn't mind switching off your videos, and then that doesn't confuse people. So I'd like to start off with Géraldine Merou, Acting Director at DG ECFIN in the European Commission. Géraldine, thank you very much for joining us today. A warm welcome to you. And my first question for you, just to get the ball rolling, is which instruments will the European Commission put in place to track progress and encourage implementation of the proposed reforms aimed at improving access to healthcare? And secondly, will the relatively short lifespan of the facility undermine in any way the effectiveness of the reforms, which generally have longer implementation periods?
Thanks, and good afternoon to all of you, and thanks for the invitation. And I'll try to answer shortly to that question. So I think an important element to mention first is the nature of the facility. The RF is a performance-based instrument, meaning that member states are paid only when they have delivered the reform and investment on the ground. So in a sort of way, by this very nature, we encourage very much the implementation, because without implementation, there is no money, basically. So that's a key feature of the facility, except we have paid a bit of pre-financing, but if nothing happened, we can even recover the pre-financing. So there is very much a commitment from the member state to implement, and then we would make sure that this is done, and on that basis, this is paid. So that's a very important element of that. And then as you probably know, so one of the assessment criteria for the RF and for the plans is basically that a plan address a significant subset or all the CSRs. And there are many CSRs on healthcare, generally on social policies. And so by then agreeing with the member states on this plan and on the commitment to address a significant subset, all of these CSR, basically, we provide a certain carrot for the implementation of these CSR, which are quite important. So again, we facilitate the implementation. Now, what we will also do is that we have in the beginning already of this facility established very close dialogue with the member states. It was already the case when we assessed their plans, And we are planning to continue that. We have even enshrined this dialogue in what we call the operation arrangement that Ingrida has mentioned earlier. So where we have foreseen that there will be at least a quarterly exchange between the Commission and the Member State, but we will do even more to follow really the implementation of the plan. And for every payment request, the Member State and we have to submit all these evidence. And again, we can have a dialogue, and we will have a dialogue with the Member State to make sure that we understand what has been done. And then lastly, we will also, Member States have to report to us twice a year in the context of the European semester. So we have developed a tool, which is a tool through which an IT system through which a member state will submit all the information, and so we will be able then to follow that up, and we will use that information and we will put that in the scoreboard that was also a demand of the European Parliament in the negotiation, and which will be operational in the course of this month. So we have just got the end of the period on the delegated act. There was an objection period for 2 months. It has been lifted on the 1st of December. So 2nd of December, we are this is implemented, and we have committed to make this scoreboard operational in the course of December. So we are very much working on it, and so that will be also a way for us and for the general public to see and follow the implementation of the facility for each member state really in a visual way. So I think that with all that, we ensure the implementation. An important part is, of course, the involvement of stakeholders. And so we have asked the member states already in their plan to indicate how much they will involve and how much they have factor in the contact with the stakeholder in their plan. And we, at every occasion, stress the importance of continuing to that. It is clear that in any case, implementation needs to be done with the people on the ground, and so that will be the case. Now, you also mentioned, Nicola, okay, is it possible to have an effectiveness? And we have only a few years. But I think that first, well, we have still 6 years, so it's quite some time. So many of the reform would normally be done during 6 years. Member States have also agreed to us on the timeline for the implementation, because these are also the steps that we will monitor, and that part of the milestones and target, as we saw it, that will be the background for the installment. So we think that many will be anyway implemented during that period. But in any case, that doesn't stop there. The European semester will continue, and we will continue the dialogue with the member state, and all other DGs are also involved into that. So even if the reform was only a part of it included in the RRPs, the rest will follow. So I will stop here.
Thank you very much, Geraldine. So if I've understood correctly, payment on delivery, close dialogue with the member states, the scoreboard, stakeholder, checking in on stakeholder involvement, and a clear agreement on the timelines with the member states directly. Thank you very much. That's given us a very clear overview. I'd now like to move to Sasa Yenko, who is the head of sector for health in DG Reform of the European Commission. Sasa, a warm welcome to you. My opening question to you is there sufficient institutional capacity at national and regional level to really absorb these funds? It's huge, it's massive, it's an enormous undertaking. Let's hear from you about institutional capacity.
Thank you very much, Nicola, for the invitation, and good afternoon, everyone. So I would like to maybe just follow on what Ingrida and Geraldine already explained before me. And maybe on one important thing that Geraldine mentioned is that we are talking about a paradigm shift here. It's about performance-based funding. So it's not just about absorbing the funds, but it's about making this paradigm shifts in the mind of the people, in the mind of the citizens, of the administrators. It is different from the cohesion funds, and this is something that we see will need to complement the absorption on the ground. Well, what I represent is DG Reform here. So what we do is we offer technical support, and we work closely with DG Recover, DG ECFIN, DG Sante, and other line DGs, DG Regio as well. So with this technical support, so how does it work? First of all, it is really important that we help the member states to crystallize the need first. So what is it exactly that they need? Then second, it is really important that the member states show their political ownership. And then that we involve in all the institutions, so the institutional capacity, and that we in this journey that we use the participatory approach, so involvement of all the key stakeholders. So in this co-creation mode, and with what is also crucial is the communication of the reforms, we try to somehow build this recipe for success. Now, one of the key features of technical support instrument is also capacity building. So if we see that the member states lack the capacity, what we can offer is to build the capacity as well in the member states. And this is what we are trying to do in helping to, as you say, absorb this massive amount of funds. So maybe just to give you a couple of concrete examples. So, for example, what we are doing at the moment is we are helping in Slovakia to implement this comprehensive healthcare reform. So what we are doing is we are reforming at all levels. So it is about creating multidisciplinary teams at the primary care level. It is about the governance of the public hospitals and also about the payment system. So we are working really closely with all the DGs that we mentioned, and we have created a huge political ownership and a team on the ground that is helping us. So how do we do that? We work with different types of experts. So one mode which is really let's say, proves to be very useful is this TAEX instruments, where we engage with experts. It's a peer-to-peer instrument where we engage with experts from other member states, national administrations, and then with this, through best practice exchange, they help other peers in other countries. Then secondly, what we also do is we work a lot with international organizations and also with the private firms and consultancies on the ground. Also, what is crucial to enable this institutional capacity, and now I'm speaking as the country coordinator for Slovenia, is to have a team on the ground that understands the context of the country and speaks the language. This is what we have seen is really crucial to actually enable the absorption and also this paradigm shift. Maybe just to finish is that we engage also different levels, so not just at the national level, but also the regional level. So depending on how the healthcare systems are organized, and we really try to somehow offer the technical support, which is really context specific. So with that, I would maybe hand over to you back. Thank you, Nicola.
Thank you very much, Cecil, for that really comprehensive overview. Obviously, there are many different dimensions. There's collaboration across different directorates within the European Commission that is ensuring the political ownership at member state level, a multidisciplinary approach, good governance, ensuring that there's a team in the country that really understands the context and the language, and relying on experts also at global level and intercountry. Very clear overview. Thank you so much for that. I'd now like to check in on the patient's perspective. We've heard about stakeholder involvement, stakeholder engagement. I'm delighted to welcome Juan José Fernández Romero from the European Patients Forum. Juan, good to see you here today. Could I invite you to perhaps share with us the expectation of the patients' communities across Europe regarding the facility's role in improving equitable access to healthcare, and perhaps, given that stakeholder involvement has been raised, say a couple of words about how perhaps EPF would expect a degree of involvement of patient organisations. The floor is yours.
Thank you very much, Nicola, for giving me the floor and proposing this question to me. First thing I would like to mention is that I'm speaking today on behalf of the European Patients Forum, which is a patient organization working on the European level. We have more than 77 members. They work at the national level, that is, they are national patient organizations, each of their own country, or they are disease-specific organizations working all across Europe. Now, tackling the first of your questions, what are patients' expectations on the ERF? As you may imagine, they are very high. we, after liaising with the membership and so on, we certainly hope that this money will be put in place to further develop the healthcare systems across each of the member states, and in doing so, reducing health inequalities that are existing at the moment. We see, for example, and here I would like to refer to a survey that we did with our members, and our members, who are individual patients, on how care and healthcare was affected by the pandemic during this year and the past year. And what we see is that the healthcare inequalities is in access to healthcare, out-of-pocket payments, availability of treatments, of medicines, shortages, and so on, has been further deepened by the pandemic. And this is a trend that needs to be tackled as soon as possible. And we think that the ERFF, through the European semester, for example, can be of assistance there. Now, there are many opportunities for doing so. For example, the pharmaceutical strategy, or even the current revision of the pharmaceutical legislation, they can work together with patients in reducing these inequalities, because it's critical that these are minimized as much as possible. Now, what can the European Commission or other stakeholders do for this purpose? We, the European Patients Forum, and our members are ready to collaborate with you and with any other stakeholder that needs in drafting this new legislation or this reform that so it is fit for purpose, that it makes a difference for patients' life across Europe. I will stop my intervention here. If that's fine, I would like to keep it short and sweet for the time being. I can further elaborate later if needed.
Thank you very much. Thank you, Juan. Finally, it's my pleasure to welcome Mr. Giovanni Gorgioni, Chair of Eurega, which is the network bringing together European, regional and local health authorities. Giovanni, thank you very much for joining us today. What are the crucial issues of coordination between European, national and regional levels for the success of the RRF? Please, the floor is yours.
Thank you, Nicola. Thanks for the prestigious invitation. The crucial issue can be reminded to the last word and item mentioned by Tomislav Sokol, and it's in the last minutes of his intervention, and it's synergy. To gain the best and the greater earning from this stock called resilience and recovery facility, we need to invest on synergy between funds and investments, not only funds and money coming from resilience and recovery facility, but also synergy with other money funds, synergy between innovation pathways and synergy with production pathways. The production of vaccine against COVID is a clear example. We carried out an innovation path and also a production and current production sub-administration path. So for the first time, we need to put innovation and stable production in a parallel way, with also with relative funds. Synergy between three different governance levels. The macro level represented by the European Union and the member states, the meso level represented by regions, and the micro level represented by local authorities. And in this governance structure, regions play an important role of a bridge between policies level and practices level to the last mile to the patient, to the citizen, and so on. So another crucial issue of coordination resides in procurement. Procurement, in our opinion, is the way by which money becomes realization, implementation, and so on. And we need also for the next 7 years, we need special rules and special laws, as in these months. We cannot think, we shouldn't think that the emergency period will end with the end of infections. The entire 7 next years are emergency times and need rules for emergency, also for, especially for procurement. So it's important for regions, for member state also, audit and monitor tools such as the mentioned scoreboard and other services from EU level to audit to gain the hope of synergy between funds and also audit and monitor towards procurement system. And I don't mean only traditional procurement, because during this emergency period we have been learning that we need system innovation. We mentioned reform, system innovation and process innovation. But for having system innovation and process innovation, we need to engage community. But demography is fastly changing, and so community concept is fastly changing, and we cannot more acquire services, equipment, infrastructure only. We need to acquire ecosystems solution, and we acquire ecosystem solutions only with innovation procurement, pre-commercial procurement, public-private partnership, public procurement for innovation, and so on. So also in this discussion, we need to maintain parallel innovation rules and habits and production rules and habits.
Thank you very much, Giovanni. Clear messages around the importance of synergy, the importance of governance at macro, meso and micro level. Innovation was also a key word in your intervention in terms of the innovation pathway linked to production, but also innovation when it comes to procurement, the importance of public-private partnership and engaging the community. What I heard also loudly and clearly was the next 7 years we're also going to be in emergency mode. It doesn't stop next year, perhaps when hopefully the COVID-19 crisis subsides. Thank you very much. We've now heard from all of our speakers. I'm going to pose them another couple of questions. Unfortunately, because of a technical blip, I cannot see the meeting chat, so I can't see whether there are any questions coming through with the chat. And I'd just like to check in with my colleague Liliana to understand how many questions are coming in through the chat. Liliana, can you hear me? We have.
Sorry, no specific questions, but we had comments. I very much hope that this is a technical issue that only you experience, and I very much hope that the rest of the people do see the chat option.
Okay, we will move
not,
on in any case. Thank you for that, Liliana, and I will check in with you periodically. Thank you. Andre, you have your hand up, please. Do come in.
Yes, Nicola, thank you very much, and thank you to all the panelists for explaining very precise the proceeding and where we are now. I have maybe a technical question, but I don't understand why the Commission decided to do the pre-funding only until 31st of December, and member states who are not ready, then they will not have the possibility for pre-funding. This is something which is totally not logical for me, not understandable. So first come, first serve somehow, but it's a bit of discrimination for member states who will be not in time and will be not entitled for pre-funding. And the Commission somehow on national level, the discussion is also very much politicized, which is very of disadvantage for the goals of the Recovery and Resilience Fund that is linked to very political questions. I hope very much for the all 27 member states there will be a solution soon in January or February, with the exception maybe of Netherlands, which not provided the plan, and that indeed effective investment and implementation. And I totally agree with the approach that the final the funding should be only if it's proof that the goals and the implementations of the projects is done, especially in infrastructure, which provides effective tool for our goals in the digital, in the climate, in the health system. So that this is only about the pre-funding. I understand that pre-funding can be also requested back if the goals are not implemented, but why the member states cannot have pre-funding also after 31st of January or of December? Thank you.
Thank you, Andre. I think your question was pretty clear. Ingrid, would you like to respond to that?
I can start, and then my colleague Geraldine, she's an expert also on procedures. So maybe just to mention that while 18 member states received the pre-financing, 54 billion of euros, as we know, the member states, after signing the operational arrangements, so 2 of them are already in the pipeline, already submitted the request for the first payment. We also know that the money is being kind of trickled into economy. It is important for us to get a reassurance. I mean, first of all, we signed the operational arrangements, then we assure that for the first payment milestones and targets are achieved. Then we continue the discussions with the member state in that regard. So the payments will be done after the achievement of the milestones and targets. Having said that, we see the process is ongoing. The process is relatively swift, so we have to go ahead relatively quickly with the member states. So prepayments in the pipeline, first payment request in the pipeline. There will be 1 or 2, so biannual or annual, depending on the member state requests with the member states to be followed up. Now, in terms of the deadlines and the specificities, modalities as regards the prepayment request, I will hand over to Geraldine. I see she's still in the call, and maybe there are some details that to be shared. Thanks.
Thanks, Ingrid. Over to Geraldine then, please.
Yeah, but the answer is very simple. We just didn't decide. This is provided by the regulation that has been negotiated by the Parliament and the Council. And this is black on white, saying that subject to the adoption by the 31st of December by the Council of the implementing decision, can a pre-financing be paid as long as this is requested by a member state. So this requires not only that a member state submit the plan, but that the plan is being assessed positively by the Commission, and the decision by the Council is taken before the end of the first year. So that has been basically provided in the regulation, and we are just as implementing the treaty. So we have absolutely no leeway to that. So it's something, and this pre-financing has been very much discussed in the context of the trilogues that I had the chance to be part of. So that is unfortunately the sad reality. So there is not much we can do about it.
Okay, that's a very clear answer. Thank you very much for that. Moving to perhaps another topic, and again jumping back to Ingrid, I'd like to explore synergies with a wide array of other EU instruments that might, together with the RRF reforms and investment, further strengthen resilience to healthcare sectors and access to healthcare. And Thomas actually alluded to some of those in his introduction, but from your perspective, where do you see some of the synergies?
Yes, many thanks. I think it was indeed MEP Tomislav Kovachev did mention EU for Health, EU Cohesion Funds, RRF, important. Now going a little bit above the instruments as such, but looking at the initiatives, what we have here at our end. So I think it's important to mention a few keywords in that context. So the Commission, as you know, continues to work towards the strong European Health Union, and in 2020, as you know, the Commission adopted a package of measures, and this is to be better equipped against the future public health crisis, and also to have in place a robust health security framework. So just to mention the Commission proposal for the cross-border health threats decision, also the reinforced mandates for European Centre ECDC, European Centre for Disease Control and Prevention, also European Medicines Agency. I mean, these are all the topics on the agenda. So that's the first to be mentioned. Secondly, also the HERA, Health Emergency Preparedness Response Authority. So Health Union was further developed by foundation of the authority, and that just happened a few months ago, September 2021. Also, MEP Tomislav Sokol, he mentioned and emphasized the Europe's Beating Cancer Plan. I mean, this further supports the build-up of the European Health Union, and also we do have measures in the RRPs that are kind of going hand in hand of the prevention. And when I talk prevention is important as a cancer, the measures related to cancer. Now, the European Beating Cancer Plan adopted in February 21, we briefly touched upon to prevent the cancer and ensure the cancer patients, their families, carers can enjoy the highest standards and diagnosis, treatment, and also high quality of life. So important cornerstone. And also briefly to mention the Commission's adopted pharmaceutical strategy for Europe, and that in last year, a comprehensive strategy, an ambitious one, and then the long-term plan to ensure that patients have access to innovative and affordable medicines. And also, last but not least, an important element for the Commission is when we look ahead, is the adoption of the regulatory proposal to create the European health data space. And it is expected as one of the key priorities for the Commission in the area of health. So all in all those initiatives, on the one hand, the instruments that we mentioned, on the other hand, the initiatives, the very recent one, and looking ahead, the others, so RRF with them are expected in a way to create synergies, and as we see also the spillover effects that would then enable to further strengthen the resilience of the health sector, and also to improve the access of the healthcare.
Terrific, thank you. Thank you for pointing out some of the building blocks towards the European Health Union that will in turn impact positively, we hope, on equal access for patients and citizens across Europe. Geraldine, I'd just like to jump back to the European semester, the CSRs. We've touched upon it, of course, and you mentioned that the RRF serves to further encourage and accelerate the implementation of the country-specific recommendations. Can you just outline in a little bit more depth the link between the current and future CSRs and the implementation of the recovery and resilience plans? I know we've touched on it briefly, but a little bit more insight would be fantastic.
Sure. So as I said, so one of the basis of our assessment is that a member state needs to come with a plan that address all or significant subset of CSRs. And why did we do that? Because these CSRs have been adopted into a multilateral context, and they represent what collectively we believe were the most important reform that the member state needs to do. So in a sort of way, and it's in a sort of way also very much targeted to the situation of the member states. And it has been communicated very well, and all member states have put forward plans. Of course, member states that had larger allocation have done a bigger plan, and it is normal than other member states. But generally, we were very satisfied with the fact that member states have really included in the plan even all or a very significant subset of the CSR. So that means that the RF will help the implementation, because if the RF is implemented in general, then the CSR will be adopted. And according to some back of the envelope, if you want, computation, we think that if all plans are adopted, about 70% of the CSR for 19 and 20 will be adopted, which is very, very much progress compared to something around 20% in the past. So that's clearly there. Now, what we are also doing is that now we had in a sort of way paused a bit the European semester to some extent. I mean, we still continue the MEP, etc. But last year there was no CSRs because we were very much discussing with the member states their plans, and also, I mean, the situation was such that it was very difficult to disentangle, okay, what needs to be done, and most of the recommendations were still valid. So now we have communicated that we will go back to European semester. We will issue some CSRs, but clearly we were not going to, we have to take into account what is already in the plans. There is no point in repeating that you should do this if this is already included in the plan. So this is something that we are for the moment looking. It's really to see what are the challenges of the member state, what are the challenges that are already taken care of by the RF, and what are the remaining or the new priorities that may come, because indeed since the last year we have issued a CSR which will be 2 years when we will adopt the new one, so things have changed. And then what we in order to really link basically the implementation of the RF and the European semester, we will very soon issue guidance for the member states to do their NRP, so this National Reform Plan program, where maybe the member states are explaining how they have addressed the CSR of the previous year and what are their plans. And clearly here we will ask them to basically also report what they have done in the context of the RF, because since the RF is such an important part, especially for some member states, I mean, less in case where there's smaller envelope, but generally large, and has a large impact on the CSRs, we will have a section in the NRP where we ask member states basically to explain how they have implemented, how their plan is also just implementing or contribute to implement the CSRs, and that will avoid that we have duplication, at the same time creating clearly a synergy between the two. But we will come soon, hopefully before Christmas, with this template for the member states to put forward the NRPs.
Thank you, Geraldine. That's very comprehensive. Juan, can I come back to you from an EPF perspective? Would you like to comment here on the linkage with the European semester? Because I know over the years EPF's done a lot of work on the semester process, CSRs at member state with some of their member organisations. Any comment, thoughts there?
Absolutely. Well, indeed, the European semester, particularly the spring package, is a very important process to us. And although we understand why this year it's been different and there's been no country reports as such, we certainly hope that from next year onwards, or at least as soon as possible, the country reports will be back at least how we knew them, because they prove for us and for the community we represent to be a very, very useful tool for monitoring what was the state of healthcare systems across each of the European Union states. And as you possibly know, in many of them, the recommendations on how to improve public healthcare provision were being made into country reports. Now, coming back to the process as it was, it will really let us see what progress is being made and where and how and by whom. And also, we think that because these reports were public, it could also be used as a tool for the member states to reduce health inequalities. That is why a patient in Eastern Europe have to experience something completely different than that in Central or Northern Europe. So yeah, that will be my comment on the European semester. Thank you, Nicola.
Thanks, Juan. Very helpful. Just as a sort of parenthesis, and many of you will know this, but EuroHealthNet published very recently a report on the European semester and RR plans, an assessment, are they drivers to promote well-being and health in the European Union? So I think that also makes some very interesting reading. Giovanni, I'd like to bring you back into the conversation with a slightly different angle. Eureka recently published a report together with the European Alliance for Value in Health that really underlined how a value-based approach could enhance systems redesign for strengthening and resilience. Is it time, in your perspective, to engage more systematically in value-based healthcare to accelerate progress? What's your thinking here?
Yeah, we think that that's the time also to rise value-based healthcare as an important tool to drive the needed digital transformation. European Union has been interested in the past in value-based healthcare with the position paper of the expert panel on effective ways of investing in health. And after that paper, so many networks, alliances, and also Eureka will be engaged and involved in scouting and scaling up best and good practices of healthcare services based on value principles. And with the previous report drafted by Eureka, also within the European Alliance for Value in Health, we demonstrated that value-based healthcare can be a useful framework also to guide and drive the building of the new normal. For a simple reason, first of all, is the best, in our opinion, the best joining key, the best joining piece to fix equity issues of Bismarck system and the cost effectiveness issues of a beverage system. And above all, one principle of value-based healthcare, and I mean bundled reimbursement, bundled payment for overall healthcare services based on health outcome and not only on the provision of simple services, can be an interesting key to guide the needed reform. We need so many reforms, but reforms important also to attract private interest and attention is the reform of financing system in healthcare sector, both I repeat, in Bismarck systems and also in the beverage systems. We think that it could be an interesting starting point for building the next European Health Union. And value-based healthcare is made up also of integrated healthcare and also of connected care that include the technology, connectivity technology, e-health, telemedicine, and so on. So that's the time to start with this cultural and scientific framework.
Excellent. Thank you, Giovanni. And I hope in your considerations on value-based healthcare, you really link the person-centered healthcare as well, because essentially you talk about outcomes, and these must be the outcomes and goals that really matter to patients at the end of the day. And I know, again, EPF's doing a lot of work on patient-relevant outcome measures, not measures that have been decided without actually including the patient's perspective. So really, really interesting developments there. We're moving towards the last 10 minutes. And again, I'll do a check-in with Liliana. Any burning questions in the chat?
No. Perhaps someone can use the raise hand option if they don't see the
I have a
symbol.
couple more questions, and I'm sure if people have anything really that they wish to pose, they will have that opportunity. And I think we're covering quite a lot of ground already. Sasa, I'd like to come back to you. Are you working with the member states on a bilateral basis only, or are there opportunities for multi-country projects moving forward?
Thank you, Nicola. So in general, we are providing support on a bilateral basis. So, but I mean, we have recently observed that if several member states, you know, have a sort of a same need that they express through their technical support, I mean, then we would definitely see how we can actually offer that support in a similar or common way, of course, if the objectives are very similar. So let me give you maybe two concrete examples, recent ones. Now going back to Giovanni's intervention, the first one on Synergies of Funds, what we have seen now in the current round of the Technical Support 2022 is that 3 countries came forward with an idea of creation of a health hub. So this would be something on how to create a hub which would enable health authorities to identify, to understand better how to use European funds and other types of funding instruments. So that's one way where we will actually work in a multi-country basis. Another one that I would like to mention is going now touching upon the health workforce and the digital transformation. We have seen that there is a real need to actually equip the health workforce with the correct tools and correct understanding of what does it mean to actually digitally transform the healthcare systems. So what we have done is in this current round, we have put forward a flagship on digital skills for the digital transformation of health and care systems. And here we also see that there are several member states that are coming together with a similar request. So thank you very much, and over to you, Nicola.
Thank you very much for that. Look, we have just a few minutes left. I think, Giovanni, when we were doing the preparation work, you were thinking a little bit longer term and thinking about infrastructures, technologies, and what we need to ensure stability and sustainability well beyond 2027. Before you comment on that, I'm just going to give you a little heads up that I'm going to go around all our panelists for one last takeaway message from all of you once Giovanni's thought about this question of stability and sustainability beyond 2027. Just a 30-second one sentence from each of the panelists to round up. Giovanni, back to you.
Thanks, Nicola. I said previously, I said that procurement is the way by which money become things. And now I add that experiences and the knowledges are the way by which things became a cultural heritage and a social system. So the next 7 years will be a setup period, but we need to have a stable platform to build the floors upon. Many of the resilience facility of the member states are constructed on facilities, infrastructures, equipment, and so on. But healthcare always will be, fortunately, a people matter, even though enabled by e-health, by technology, and so on. So we need to complement every resilience and recovery facility with a plan for workforce. The existing ones through upskilling and reskilling as existing professions, and a plan for new workforce recruitment, new professions, and new skills. Those one put during this pandemic period.
Thank you very much, Giovanni. The human factor is really vital. Going round our virtual table then, Geraldine, one sentence from your side, please.
Well, but I think that in my view, the RF will contribute to many policies, but in particular, the healthcare was a major challenge. It remains a major challenge, and I want to maybe conclude by saying that I would encourage all of you to look. We hope on the mid-December we are out with our scoreboard, And I think that having a peek at that would be very useful for all of you to see basically, and then over time, because we will update that very regularly, so you can really see the progress live, basically.
Thank you, Geraldine. To Sasa, please.
Thank you very much. I will just borrow this African proverb. If you want to go fast, you go alone. If you want to go far, you go together. And I think it is really crucial that we involve everyone and that we put people at the center. Thank you.
Thank you very much. To Ingrida, our keynote speaker, please.
Yes, just building of what Saskia said, going together. I think the first step is preparation, adoption of the plans, but the most important is the crucial one is the effective implementation of the plan. So going together, working with the member states and trying to create synergies, also using other EU instruments and other EU initiatives.
Thank you very much. And Juan.
Thank you, Nicola. Well, I would like to finish my intervention by saying to the European Commission, the European Parliament, and all stakeholders present in the call here today, that for moving forward in improving Europe's healthcare systems for and with patients is the key. Please do engage with patient organizations such as the EPF or with individual patients as you think is best for reducing health inequalities across Europe, for improving access to healthcare overall, for reducing medicine shortages, and so on and so forth. Thank you, Nicola.
Thank you, Juan. And Andrea, co-chair of the Interest Group, before I say a round of thanks to everybody, I'd just like to give you the opportunity to take the floor again. Please, Andre, the floor is yours.
Thank you very much, Nicola. Again, also from my side, thank you to all of the panelists. We have a lot of work in front of us. You will have, as usual, the support of our platform in the informal group in the European Parliament for all stakeholders in the health sector, and hopefully as fast as soon as possible, the all 27 plans are adopted, but not only adopted, starting to be implemented successfully, and we will have the results soon in the next months and years. Thank you.
Thank you very much, Andre. So we're coming to the end of our very interesting session today. Just to let you know that the recordings will be on the PACT website, and there will be also a summary report picking up on the key aspects of our discussions today. I'd like to take an opportunity to thank our co-chairs of the Interest Group on Equity of Access in the European Parliament for their continued support and commitment. So Andre, please take that message back. I'd also like to thank our excellent speaker, Greta, and our panelists for today's really enlightening discussions. I've certainly learned a great deal, and I hope that participants have as well. And I'd like to thank you as the audience. And finally, I'd like to thank the PACT team, Susanna, our President and Chair, Stanimir, Secretary General, Alexander, who is providing a lot of support behind the scenes, and in particular Liliana, the PACT coordinator, who's worked really hard to ensure the success of this event. So a big thank you to all of you. Happy and most of all safe holidays, and looking forward to seeing you next year. Many, many thanks. Bye.